towards the management of COVID-19 patients. I am delighted to announce that today we have surpassed the 100 mark for recovery of patients. In the last 24 hours, we have discharged 8 patients from our hospitals. This brings to 106 the total number of our recoveries. We have noted the number of recoveries steadily going up while fatalities have stagnated. In the last 1 week, the number of those who have died from COVID-19 have remained at 14. Within the same period, we have discharged 39 persons. This is an indication of the dedication of our healthcare workers. From the bottom of our hearts, we want to thank our medical and health workers for the role they have played in this fight. They remain our frontline soldiers, without whom fighting this war would be extremely difficult, if not impossible. I therefore want to appreciate all those organizations that recognized the critical role of healthcare workers and have come up with initiatives to care for and appreciate them. In this regard, I want to acknowledge Absa Bank Kenya PLC and Minet Kenya Insurance, who are now providing psychological support care to our health care workers and those in quarantine facilities, isolation centers, and their families. I wish to remind those who may be experiencing any psychosocial distress to reach out to them on this number for counseling and support. The number is *202 *04#. I repeat again, for counseling, support, you reach out to this number, *202 *04#. Even as our health workers dedicate their time to manage our healthcare facilities, their efforts alone will not be enough in flattening the curve. It requires all of us to exercise our individual contributions by observing the various intervention measures we have continuously advocated and announced. I want to thank Kenyans for observing these measures. The achievements we have registered could not have been possible without everyone's cooperation. I want to thank our mamambogas, boda operators, matatu operators, the youth, the taxi drivers, local entrepreneurs, and many others for their contribution to this fight. However, even as we celebrate these achievements, we cannot afford to become complacent and lower our guard. We must stay focused and maintain the course. And I want to appeal to those Kenyans who may not be strictly following the directives to please do so. It's extremely important that we follow these directives because it is the only way that we will be able to interrupt the transmission cycle of the virus and register some level of success in bringing down the numbers. While at this, I would also like to urge counties to strengthen the multi-sectoral structures so that various sectors play their respective roles in responding to this pandemic. And I'm sure that Governor Kuti will talk to that when he comes to the podium. Communities should regularly be sensitized on infection prevention and control measures for COVID-19, including the role of nutrition in boosting the body's immune system and speeding recovery from illness. Early this month, the Ministry of Health released 2 guidelines, key nutrition messages to contribute to prevention of COVID-19, and the interim guidance for nutrition management of COVID-19 for health workers in treatment and isolation centers. These guidelines give recommendations of the foods we should consume to remain healthy and therefore I urge county governments to make use of the guidelines and to disseminate the information to the communities. Yesterday, we marked World Malaria Day. On a light note, we would like to remind all of you that mosquitoes are not under quarantine or lockdown. They are still spreading malaria, and the same for other carriers of pathogens. We need to protect ourselves from mosquitoes and to be on constant lookout for malaria symptoms such as fever, headache, joint pains, nausea and vomiting, which coincidentally are also symptoms for COVID-19 disease. If you experience these symptoms, you need to visit your nearest health facility. Malaria testing and treatment are still available and are offered free of charge in all government health facilities. County health departments in malaria transmission areas at the coast, lake region, and the Western Rift need to be vigilant and closely monitor malaria trends to ensure that there is no outbreak of malaria which may further strain our health services. Following the directives of His Excellency the President, the National Emergency Response Committee on Coronavirus has today met and will be releasing guidelines for partial reopening of eateries and restaurants. In the meantime, the National Emergency Response Committee has directed the following. 1. Testing of truck drivers to start immediately at all border crossing points. The county governments to increase training of their healthcare workers by utilizing the already trained personnel as trainers. 3. The Ministry of Health, in collaboration with the county governments, to identify COVID-19 isolation facilities at county level 4 and 6 facilities. In the last 24 hours, we have confirmed 12 new cases of coronavirus in the country, bringing the total number of confirmed to 355. 8 of these are from Nairobi and 4 from Mombasa. All the 12 are Kenyans, but 3 have a recent history of travel from Somalia. They are aged between 14 and 60 years. The Nairobi cases are spread between Kibera 2, Karen 1, Dandora 1, Isli 1, Kasarani 1, South B 1, and Umoja 1. Mombasa's cases were found in Mvita Kuze 1, Misho Moroni 1, Mvita Bondeni 1, and Barsheba 1. I thank you, and I now take the opportunity to invite CS Magoha to come and make his address.
Mine will be a very short one. The government loves all our children, both with special needs, those who come from poor vicinities, the middle class, and those who are able. I want to emphasize the fact that for the past 4 weeks or so, the children have been on normal vacation, an activity that will end on the 4th of May of this year. And in the interest of the safety and lives of our children, our beloved children, the government has decided to extend school closure for 1 month, effective from the date of opening. During the intervening periods, there will be many interventions that will depend on how the government is able to control this disease. I want to emphasize one point, that whenever the examination is going to be administered, every child, every Kenyan child will have been given the opportunity to cover whatever time that is lost before the said examination is administered. At this point that I'm speaking to you, the government has not decided to postpone both the Kenya Certificate of Primary Education and the Kenya Certificate of Secondary Education. I hope I have preempted your questions with regards to exams. Let our children enjoy their last week on holiday and then start the 1 month that has been added to them. Thank you.
Thank you. I would like, on behalf of the county government, first to thank His Excellency, the President, for extending the measures of the curfew and also the movement in and out of the counties with high COVID prevalence. This is because we feel the results are yielding the measures are yielding good results, and therefore we fully support as county government. We also fully support the initiative to push manufacturing by local capabilities, to encourage our local capabilities to manufacture personal protective equipment, ventilators, face masks, and only we now urge that KEBS, that is Kenya Bureau of Standard, to also enhance their capability at the county level so that this manufacturing is not only centralized in Nairobi, but also in the counties, because a lot of efforts are happening at the county. First, a lot of young people, women groups are manufacturing face masks. It is important that those face masks are standardized and are verified so that they meet the required specifications. Talking about face masks, I would like to point out that face masks are put on to prevent entry of the virus into the nose and into the mouth. I am seeing like 60–70% of Kenyans putting face masks below the chin, and therefore walking like that. They have face masks, but they are not putting it in the right way. The face mask purpose is to prevent the entry of the virus or the exit of the virus if you are infected. Therefore, let us carry this message very strongly that we should wear the face masks appropriately so that it does the function it's meant for. I would like to also state that because of stigma of health facilities, pregnant mothers are fearing to go to health facilities. Immunization has now gone down, and today in our National Emergency Response Committee, efforts are being discussed, and there is going to be discussion between Council of Governors and Ministry of Health in order that we identify COVID health facilities away from normal health facilities so that the gains that we have made in immunization and in reducing maternal mortality because of the attendance to antenatal clinics, the malnutrition that we have countered because of regular weighing, and other activities like HIV and TB should not be lost because of mixing COVID patients and other normal patients, to the extent that people now are shy to going to seek health care. So this is, I think, a message I want to deliver. And in the meantime, I would like to encourage community health volunteers to encourage those services to continue at the community level, and also encourage those who need to go to deliver at health facilities or to be attended at health facilities to continue as normal. Finally, I would like to comment on what has appeared on yesterday's papers about classifying and graduating performance of governors. I think it is not in the spirit of the time to classify governors. This is a time for unity of purpose. This is a time for encouragement, and it is not time to call others villains. I don't think it is fitting the time. We have statistics from all counties as Council of Governors about the formation of county emergency response committees have been formed in all counties. Counties have put in place the various requirements by Ministry of Health. I will seek and I will seek the indulgence of the Fourth Estate to desist from, at this particular time, engaging in classifying or political initiatives, because this is the time all Kenya is supposed to come together. And the Mwananchi has his role, county government have their roles, and national government have their roles. Let us all play our roles, and let us have unity of purpose, and let us not have a system that discourages any of these players, because we need each one of them at this particular time. Thank you very much.